disease, but for me, health is much more than that. The world at the moment has inadequate policies to stop the global temperature rising to more than 1.5 degrees centigrade over pre-industrial levels. I don't think there's any disagreement with that. And worse than that, we're simply not implementing the policies we do have. And that's where governance comes in, because that is a problem of governance. So here's a visual representation of where we're at the moment. So that green line at the bottom is what we need to do in steadily reducing our greenhouse gas emissions to get to 1.5 degrees by 2035. The blue line is the policies that we have in place in Britain, and Britain doesn't do badly when it comes to policies compared with many other countries, but you can see that as they stand at the moment, they won't get us to 1.5 by 2035. And the gap between what we need to do and what we've committed to doing is called the ambition gap. But the line that really matters is the one at the top. What is actually happening? And we're not doing nearly as well as we need to do, and that is the delivery gap. And governance really is about both of these, but it's perhaps more specifically about the delivery gap, actually delivering on what we've committed to do, because it's very easy to make promises, but it's very tough to implement them. So what is governance? Well, this is a definition from Nari Woods, a professor in Oxford. She says governance is the proper functioning of institutions and their acceptance by the public. Good stuff. But the way I think about it, my definition at the bottom there is governance is the mechanism to make missions, strategies, and policies happen. And I might add, to achieve the culture you would like to achieve and follow your values. We'll be hearing more about culture and values in this. So it's about making things happen rather than just providing promises that are not fulfilled. And as an aside, this is a picture from the Lancet Commission on the Lancet Countdown on Climate Change, which shows up until 2016 what is happening with carbon emissions from health systems. And what you notice immediately is that almost all of them are going up. Russia's collapsed there, but not because of any commitment on climate change, but because of what happened more broadly. And you can also see that up there at the top is the USA, which is going up and up and up and up, and seems to account for something like 50% of all the emissions coming from health systems around the world. And if we all had a health system like the USA, things would be completely and utterly out of control. And luckily, we don't. So, governance of an organization. So this might be the NHS itself, and we might hear more about how actually the NHS, with the Greener NHS program, has put a lot of emphasis on governance. And Nick Watts, the Chief Sustainability Officer, talks about how governance runs throughout NHS England, and every place has got its own particular plan, which is what's needed. It might be an NHS trust, or it might be very relevant to this conversation, a Royal College. So we're all used to the idea that every organization must follow the law. If you're the trustee of an organization and you do something illegal, you can be very liable. And that's legal governance. And we're also used to the idea that every organization, whether it's for profit or whatever it's for, must balance its budget. As the great saying of the nuns goes, no margin, no mission. And that's financial governance. And we've long been used to legal governance and financial governance. Those of you with older memories will remember that Liam Donaldson, the Chief Medical Officer of England, introduced the idea of clinical governance, with the same sort of idea that an organization like an NHS trust had to be responsible for what happened clinically as well as what happened legally and financially. And I would argue that exactly the same attention is needed for environmental sustainability, and we might call that environmental governance. And I also suggest that financial governance provides a very good model for environmental governance, that we perhaps don't need to invent a completely different system, that to some extent we could follow what happens with financial governance. So here are some steps I suggest that every organization, all the ones represented here, should take. So the organization must commit to achieving a carbon net zero by a particular date. And the country has done that. The NHS in England has done.
Sorry, we seem to have lost Richard. It's not me, it's Richard, isn't it? Somebody move. Okay. Okay.
Yeah, it is Richard, yeah.
Oh, what a shame. I know there was some work being done on his IT, so he will try and rejoin us. I wonder, should we, I see Adrian has joined us, so welcome, Adrian. We could, while Richard is trying to get back in line, perhaps just move on to the next, oh, yeah, he's gone. So options are to wait a couple of minutes for Richard to come back in, or to move on to the next presentation. So what I'll do is I'll give it a minute, if that's okay, so that he can continue with this presentation. And if he doesn't, then perhaps we can move on to the next speaker. So we'll give it a minute, and I'll drop him a message as well. Sorry about this. Richard's just coming back in on his phone, and I'm going to share his slides because he seems to have lost his computer connection. I'm so sorry about this. So Richard is having difficulty in getting back in. It's taking a while to connect. So what we'll do, if it's Adrian is also having difficulty in connecting, unfortunately. So I'm going to try and sort that out. If I could possibly, if Alison and Liz, if you don't mind taking over, I'm really sorry about
That's
this.
fine.
And I'll hand over to you two, and I'll try and sort out the tech in the background. Okay, thank you.
That's absolutely fine. Thanks, Elaine. So, Alison, are you putting up the slides? Great. So I'm just going to tell you a little bit about the work that we've been doing at the Royal College of Paediatrics and Child Health, and Alison's going to, who's our strategic project manager, is going to be assisting me with this. I mean, the first thing, next slide, is, you know, why did we think we needed to do an action plan? Now, I don't need to tell this audience, you know, the importance and the crucial importance of the recognising the climate crisis and taking action is now. But, you know, for the Royal College of Paediatrics and Child Health to get involved in this space is really a no-brainer. You know, 90% of our world's children are exposed to poor air quality. There are avoidable environmental risks involved in a huge number of deaths. We will have a huge number of additional deaths attributed to malnutrition caused by food poverty related to climate change. And by 2040, 1 in 4 children will be living in areas that are at risk because of high water stress. So, you know, it's really, really, really important for everyone. And it's even more important for those of us who work with children. And we can't close our ears to it. We must point out the climate crisis is a child's rights crisis. And for many reasons, children are even more vulnerable than adults to the effects of climate change by virtue of their physiology, anatomy, and the environmental issues that they face. And of course, they also have the rest of their lives. And therefore, it's our duty to protect them now and to protect them for future generations. And the other thing that's really important to us as a college is that it's really important that we include them and listen to their voice and what they want us to do. And one of the things that rings in my ears all the time at the moment is something that you know, I heard from one of the discussions with young people, is that they want us to be the adults that they need. We need to be the adults that help our children's future and live up to that post. So that's why we're doing it. Our journey really started in 2020 when we had a member-led motion to conference asking us to declare a climate and ecological emergency, which we did indeed pass at our May 2020 AGM. So this led us to develop our, and in October we did declare a climate emergency. So this led us to then decide what we need to do is we now need an action plan in order to take this work forward. So we developed our climate change working group, which is something that I am chairing at the moment. And we asked for member engagement in our projects. And we had a huge response, which I'll come on into in a bit. And we have formed our structure, which I'll explain as well. In September 21, we developed our new strategy for the college as a whole, and we've embedded climate change as a priority within our strategy. In October 21, we came out with a position statement about the climate emergency being a child rights crisis and what we needed to do about it in preparation for COP26. And in January this year, we launched our detailed action plan. Next slide. So in our strategy, we describe the devastating impact of climate change, and it's the biggest challenge of our generation, and explain what we did in terms of declaring a climate emergency. So the strategic aims that are embedded right through our strategy are, number one, that we need to harness knowledge, data and intelligence to improve the quality of care for children and young people. The second is that we really need to equip our members with the skills and knowledge they need. So we need to provide them with the information, the training, the assessment to being able to be leaders in this field. Lastly, we need to be able to speak with confidence and authority as an organisation on the health issues that matter to children and young people, and the policies that need to take forward our mission. And lastly, we want to develop communities of support. So our strategy was about communities of support in lots of different ways, but to ensure that we attract people to the college and we support them in their careers, and that we make sure that all the work we do is financially sustainable and well resourced. Next slide. So this is our structure. So this is our governance structure. The action plan is intended to be a 3-year programme, it's headed by the Board of Trustees, and as a representation of the Board of Trustees, I chair the Climate Change Oversight Group. And under the Oversight Group, we have a expert reference group, which is just getting going and is chaired by our president, Camilla. And we have a staff reference group, which is led by our CEO, Joe, and by Alison. And then we've developed 5 work streams, each of which have a chair or a pair of chairs. And the work streams are: 1, advocating for change. The second one is about research for the impact on children and young people. The third work stream is about our building, our resources, our conference. The fourth is how we support our members. And the last is an international work stream. Now, all these groups meet independently and then come together for the climate change oversight group. It's really good that we've got the senior leaders of our organisation involved at every single stage, trust board members in it, but most important, we've got over 80 passionate colleagues who are offering their time to support the work streams. And, you know, the interest, the enthusiasm, passion, knowledge and skills of this group continue to astound me. And then we do have a dedicated staff member, Alison, who's going to talk to you all in a minute. So our action plan is broken down into 6 areas, describing in more detail what each of those 5 groups are doing. But most importantly, we also have a 6th group. So RCPCH and Us is our youth engagement project, which we don't do anything in the college without consulting with RCPCH and Us. And again, we have an amazing group of well over 1,000 young people and people who work with them around the nations who support us in everything we do. And they've also got a climate change group, which has been particularly helpful in making resources and the case to share with children and families, and to make sure that we do our job to make sure they're listened to. Next slide. So the overall mission statement for climate change for our young people is as on here. So they really want to make sure that we work to improve the life of all children and help the NHS to become sustainable and climate friendly as possible to ensure their future. And they want to support the college in the mission and help make sustainable paediatric healthcare with carbon neutral and patient focused solutions. So that's something that's really important to us, and they have been absolutely fabulous. So I think that's my introduction to what we're doing at the college, and I think I'm now over to Alison, I think, to take us through our more detailed ambitions. Is that right, Alison?
That's right. Thank you, Liz. Good afternoon, everyone. Nice to see you all. So just to quickly introduce myself, I am a staff member at the Royal College of Paediatrics and Child Health. I am our lead for strategic projects, which is any kind of projects and programmes that cut right across the college and are a core part of our college strategy, which, as Liz has just explained, currently climate change action is one of those. And just to kind of build on what Liz has been talking about, within our climate change action plan for the college, we've got 6 clear ambitions of what we want to achieve within the 3 years of the programme. And these are up on the screen now. So we are a Royal College. We've got 21,000 members across the UK and internationally. So we want to effectively use that collective voice and expertise as paediatricians to influence the national and international climate change agenda, focusing, of course, in particular on the health impacts that are faced by children and young people now and into the future. We also want to look at research and advancing research on the effects of climate change on child health, and looking both at the impact of the climate crisis on young people's physical health and their mental health. We want to look at ourselves as an organisation and reducing the carbon footprint that's associated with the college, and developing an ambitious college plan for sustainability. We want to be supporting our members to advocate for improved sustainability in their clinical work and their workplaces, and making sure that we're supporting the ambition for the NHS to be net zero by 2040. The fifth ambition is looking at developing and promoting training for our members on key aspects of sustainable healthcare. We are a big education. Education is a core part of what we do at the college, and so particularly looking at what we can do on that. And then finally, but by no means least, as Liz has talked about, we want to be making sure we are supporting children and young people's own advocacy on the climate crisis, and supporting and advancing the narrative that the climate crisis really is a child rights crisis. So those are our ambitions. And we have just about completed our first year of having a climate change action plan and a climate change working group. So these are just a few of our highlights from our activity in the first year. We obviously have published our action plan, which we're very proud to have done, and we'll be looking actually in January, in a few months' time, at doing a refresh of that to mark our progress. We are very pleased to be working very closely with the UK Health Alliance on climate change, and this is a member of the executive, which is great. We're working in collaboration. We've got a whole host of resources now on our website for college members and broader child health professionals to make use of. We have embedded this topic very much into things like our annual conference, and running dedicated sessions on climate change and sustainability, and had a fantastic number of abstracts submitted. We are doing lots of advocacy work. We're very supportive of the Ride for Their Lives group, and we'll be doing our own ride in a couple of months, actually in September, so next month, for the college, which is great. And yeah, a few things here that Liz has mentioned. So we published a position statement on climate change to make sure our advocacy position was cemented. We took that to COP26 and networked with the health and climate change community. And we've also started holding our own on that education ambition, holding our own events on climate change, and releasing webinars and podcasts to support our membership with this topic, and what they need to know and how they can take that back into their hospitals and trusts. So we like to measure our impact, I guess, in a few different ways. So this first slide is very nice and pictorial, trying to show some of our impact across the last year. This shows some of our highlights, really. So we very much have this embedded across our communication strategy now for the college. So we have what we call an always on communications approach to talking about this, because climate change never goes away. So we have both our proactive communications when we are launching blogs, statements, that sort of thing, but we also are very much now trying to make sure that we are reacting to what happens in the external environment, and putting out statements to welcome positive changes, but also to express our concern about reports such as the IPCC report, which came out earlier this year, and how worrying that is in terms of child health and future generations. So establishing ourselves as a leader and somebody that comments, an organisation that comments on this space, has been an important thing we've tried to work on in our first year. There's just a few highlights there, but really, in reality, we are trying to track things a bit more formally as well in terms of our action plans. So we had 38 specific actions in our action plan for year one, and we've completed around half of those, and 38% are in progress. We've got a handful that we haven't managed to start yet, but we are in the process now, as we reach the end of year one, of reviewing how we've done and reprioritizing what we want to achieve for year two, which will start in January 2023. And we are in the process as well of trying to seek some additional funding to accelerate the pace on some of these projects. So we haven't currently got a clinical fellow for kind of greener paediatrics working with us at the college, and that's something we'd really like to get off the ground, and that would really help us to accelerate some of these projects. So that's an ambition we've got for the moment to try and take forward. There's so much that the passionate members in our group want to achieve, so we want to be able to help facilitate that if we possibly can. And then just my final slide is just some of our priorities for year 2 and year 3, just in case this helps spark ideas across other organisations about things that you might want to also look at doing. So we have very much in the first year focused on establishing our voice and our advocacy, but we want to, you know, look at expanding our policy and public affairs work on this topic. We are going to be looking at doing a full carbon audit of the college. You know, we've already made lots and lots of changes to the way we operate to build in sustainability, but, you know, we know there's more that we can do. So we're going to be looking at that more formally and taking forward the actions from that. We're going to be focusing a lot more on what we can do about research gaps in this topic when it comes to children and young people and climate change, looking at what we can do internationally, potentially forming an international paediatric alliance on climate change and child health with other paediatric associations globally. We're going to be looking at, again, at harder education and what we need to do in terms of supporting education and training for our members, and specifically looking at publishing a toolkit for talking about air pollution, which is one of the biggest issues in this UK context relating to climate change that we want to support our members with, talking about with patients and families, and just generally continue in how we embed climate change action across the college. And particularly thinking about that sustainability of this work beyond the official length of the 3-year programme. And that's something that Liz and I will be very focused on and mindful of as we move into the next year. So I'll pass back to you now, Liz, I think, for the last couple of slides.
Yeah, so just before I come on to that, I mean, I will talk about, you know, this is a 3-year programme, but it's not going to end at the end of 3 years. We anticipate that by that time, the principles, the materials, the ways of thinking, the ways of practicing will be so firmly embedded in the business as usual for the college, and also very firmly in our governance structures, which we'll hear more about in a bit. So it will continue. So in preparation for this, Alison and I had a bit of a chat about what it is that we've learned so far and why it's working for us. So, you know, some tips maybe for some of you who are trying to do something similar in similar organisations. So the number one is obviously you need an Alison. So, you know, a dedicated project manager has been absolutely crucial. And of course, it can't be anybody. It needs to be somebody like Alison, who's been such a force in supporting us all through all this work. But to actually have somebody with the time and the contacts and the resources to do the work is really important. And the second is to embed it firmly in the strategy. And the timing of us declaring the emergency coinciding with our 21-24 strategy was really useful for us to be able to embed it in everything we do. It's crucial that you have senior leadership buy-in, and we've had that from the word go. You know, when we ask for volunteers to be on the groups, we have more people from the senior leadership team right the way down to the most junior members offering to help, but the senior leadership buy-in has been absolutely crucial. But the member group have been incredibly engaged, and it has really helped some people who want to get involved in the college and hadn't really found a home for themselves to become more involved in the college, which is something we will obviously build on for the future. So that our members have been fantastic with this, and you know, we're doing something that our members really want us to do. And the last thing was to actually be able to establish a plan and commit to it. So that's been the things that we think are the ingredients for success, and why we've managed to achieve what we think is a fair amount of work within just 1 year. Next slide. So if you do want to find more about what we're doing, you can use this barcode. You can go onto our college website and see climate change. And I think the material, you don't have to be logged on as a member to access the materials, do you, Alison?
No, it's all completely open.
It's all freely available. So please go there to look at our position statement, read our detailed action plan, and look at some of the resources. And if anybody is a member of the Royal College of Paediatrics and Child Health, please join us and get involved. If anybody as an outsider has any ideas about things we might to include as resources or organisations they think it'd be helpful for us to link to, please get in touch. And that just takes us on to the last slide. So, you know, the Climate Change Working Group has really been a breath of fresh air for me. You know, it's been the source of my my energy really in my college work. And these are just a few slides from things that we've been involved with. So in the top left corner, you can see, was that the Cardiff meeting, Alison? So it was a meeting where we actually had some of the local young people talking about what the importance of climate change was to them, was at our Welsh National Conference. There is a screenshot of us in November when we had our first members educational event afternoon, which Richard and other people who you will be familiar to, I'm sure, spoke at. Various cycling events. So Camilla, our president, did take part in the ride for London to Glasgow. She didn't cycle all the way, but she did cycle and got very wet. Then on the bottom, you can see us at COP. A small group of us, all our chairs of our working groups, went to COP, and that's outside one of the pollution pods in Glasgow. And then lastly, the middle photo is some of our leading lights within our programme. We had our annual conference in June, and what was really lovely was we had a morning education session and workshop, and then we had a networking lunch. And this was the first time most of our groups had actually, most of our members had actually got to meet each other personally. And again, there was lots of energy in the room. So this has been really rewarding work. We hope that it will continue at the same pace, and we hope that others might be inspired to do similar within their organisations.
Thank you. Thank you so much, Liz and Alison. As somebody has put in the chat, certainly a fair amount of work over a year. And it's, I'm sure it will be very, very inspirational and helpful to others, seeing how you've embedded that structure and then the plan to enable delivery of the work. So I think Richard has joined us back in. Richard, are you there?
Yeah, no.
I
apologize for what happened. I can't really blame Virgin Media because I don't think my internet has gone down this year until now. And they did send me a warning yesterday saying that they were going to be doing work. So, I mean, I think if I'd been a little bit smarter, I might have set it up before I began my talk. Anyway, here I am, and I apologize. So did I get to step 2? Can you tell me that?
You were about midway through step 1 when we lost you.
Okay, well, let me go back to step 1. So I'll start at the target should be bold but achievable. I mean, in a way, that's a statement of the obvious. I think it's very important that it includes all the sources of carbon used by the organization, and about 2/3 of those are likely to, the carbon footprint is likely to come from suppliers, and some of those will be overseas. So it can't be just, what we're doing in Britain and what we control. And I certainly praise NHS England for including all of that, scope 3 as it's called in the jargon. But I think it's also important to have targets for each year. It's rather too easy to set a distant target and know that you're not going to be around when you fail to reach it. I think it's very important we have it for every year. And I would add that I think the proportion of the target that depends on offsetting or sequestering should be no more than 10%. If it's something like 20, 30%, it's not an adequate plan at all. And a lot of people would argue that we should have an absolute zero plan, not a net zero plan. I heard Nick Watts talk about how it was going to be only 8% of the NHS plan. Later, he talked about it being 10%. And perhaps he varies a bit. I hope it's not going backwards. But I think that's very important. Then step 2, and as we just heard from the paediatricians are doing, measure the carbon footprint of the organization and commit to reporting it publicly, at least annually. And I think the reporting it is very important. To have a target that you don't report, I think is hopeless. And I think it must be public, not ideally just to your board, but to everybody, so the whole world can see. Now we have, as you're probably aware, we have quite a way to go with developing the best measures of measuring the carbon footprint. It's very imperfect at the moment. But again, I don't think we can let the best be the enemy of the good. It's important to get ahead and measure your footprint as best you can. The measures will improve. There'll be more learning, more resources put into this. But at the same time, as you improve, I think it's going to be important to make sure that you can do a year-on-year comparison, so that you can know whether you're moving in the right direction or not. Step 3, as we've just heard Liz and Alison describe, is to develop a plan. And I think it must be a SMART plan, which, as you're probably familiar, means it's specific. What exactly are we going to do? It's measured. How will we know if we've achieved it? It's assignable. Who's going to do the work? It's realistic. It's not pie in the sky. And it's time related. When are we going to have it done by? And again, just as the college described, it should be published. And again, I repeat, the plan will have to include proposals for working with suppliers, because, as I've said, 2/3 of the footprint is likely to be from suppliers. And then if you look at the carbon footprint of, say, a pharmaceutical company itself, you'll find that about 2/3 of their footprint is suppliers. It goes endlessly reiterating, which emphasizes how all of us have to change. It can't just be change at one level. And then step 4, the board must review progress or the lack of it at least each quarter, and look at the carbon footprint at least every year. And maybe as you begin, you could do it more often because it might fall more rapidly. And in terms of thinking back to finance and using it as an analogy, the board really ought to include at least one member with expert knowledge on sustainability and measuring carbon footprints. I mean, every board has somebody on it, and usually at least 2 people with a detailed understanding of finance. I mean, I've had the unfortunate experience in my time of chairing a board in Bangladesh where we had a budget of $50 million and 5,000 staff, and we didn't have anybody on the board who understood finance, and it was a disaster. So I think really we're going to need the same when it comes to sustainability. The board will have to devote staff and resources to achieving the plan, and I fear that there are quite a lot of plans around where there are no resources devoted to it and there are no staff dedicated to achieve it. Again, as we just heard from the college, Alison is the person who's leading on this, and there has to be such a person, I think, and there have to be people and resources, otherwise it's just rhetoric. And then step 5, there should be somebody in management who leads on achieving net zero. Ideally a chief sustainability officer, as the NHS has in England, right at the top of the organization, reporting to the chief executive, again, using an analogy with a chief financial officer. And then each year, I think there needs to be an annual external audit and reporting on progress. Again, you have finance people on a board, you have a chief financial officer, but every year you have a financial audit, and what it says is extremely important. So what are the challenges? Well, one is developing people with a deep knowledge and experience of achieving sustainability and net zero. Whereas we have dozens and dozens of accountants and financial auditors, we don't have the same capacity in sustainability, and we need to develop it. We need better ways of measuring carbon footprint, and there is, I think, quite rapid progress being made on this, and measuring different areas requires different methods. I think too that we need to develop internationally agreed standards. Again, this is what happens in financial accounting. How exactly do you present your accounts? Otherwise, it's quite easy to present them in a way that makes things look a lot better than they are. You have to find a way to work optimally with suppliers, who in their turn will have to work with their suppliers. And that's a very hard bit of this challenge. And if you talk to Nick Watts, you'll learn much more about that. And I think we do. I've built this around net zero because I think it is measurable and it's easier to think of the governance, but we're going to need to move beyond simply committing to net zero. And as I gave this talk, I was very conscious that, as is so often the case, I'm talking a lot about mitigation. I haven't really talked about adaptation at all. But seeing as the problems are already here, as we've all experienced, we have to be thinking about adaptation as well. And in fact, I heard an interesting presentation a few weeks ago at the Academy of Medical Sciences, where a professor from Leeds argued that we're so short of time that we should be emphasizing on those actions that are both mitigation and adaptation, which I thought was an impressive argument. So I apologize again for having disappeared in the midst of my presentation, but I look forward to the discussion. Thank you.
Thank you, Richard, and we are very pleased you were able to join us and finish your presentation. I am pleased to say that Adrian James has also managed to join us. He was also having some issues. So Adrian, I'm hoping you're still there, and if you can unmute yourself and say hello.
Hello, I think I'm there. Can you all?
Oh, great! I see you now. Sorry, I couldn't see you on my screen the way it's set up, so had some doubts. It's great to see you. Thank you so much for joining us. So I'm going to hand over to you now. So as you'll have seen, we've already heard from Richard Smith speaking about how to achieve a sustainable organisation with a good governance structure, and Liz and Alison have presented on how they developed their action plan for paediatrics and child health. So over to you to tell us how you went about developing your embedding sustainability at the Royal College of Psychiatrists.
Great. Well, thanks, Elaine, and good to hear from you, Richard, and incredibly impressive work at RCPCH. I really enjoyed that presentation. You've done such a lot in such a short period of time. I think, Elaine, are you ready to share my slides? So, I mean, just by way of introduction, in terms of embedding this in an organisation, you've got to believe it. You've got to actually really mean it. People have got to see that you mean it. You've got to talk about it all the time, not just do an occasional presentation on sustainability and climate change. It's got to be within everything that you do. Every single presentation that I do, I talk about my priorities, one of which is sustainability. So it's got to be intrinsic to everything, not just an add-on. It helps if you've got a mandate. I was elected president now nearly 2.5 years ago, and just over 3 years ago I was elected, and it was one of my 4 priorities. So I was able to come in as president and say, you've elected me on this basis. I think that really helps. It really helps also if you've got your officer team who are obviously behind it. I think you need to take things to your governance structures, to your trustee board and to your council, which is what we did, and got them to sign up. And I was relieved to see that they wholeheartedly signed up to it. You have to actually have an action plan. You have to say you're going to do something and actually do something. People have got to see visible things that they can see when they come into the college, that you're not only talking about it, they're seeing a change. I was glad to see all the cycling with the RCPCH. I'm a passionate cyclist that I think I was always a bit of a pain really to the college in terms of turning up on my bike. They weren't quite sure what to do with me. And that's often been my experience at work and within other organisations, that you're kind of, what are we going to do with the cyclists? Where we've managed to turn that round to embrace people, to encourage people, make it something people really want to do, really welcome people. And I'm very proud that in the place I work in Exeter, just outside of Exeter in Dawlish, in secure facilities, we've got great cycling facilities and showers and everything, and so people really want to do it, and all the cycle sheds are all full every day. Sometimes I can't get my bike in, which is very annoying, but I've only got myself to blame. So I think those, broadly speaking, those are the things you've got to do. So in terms of just running through the slides before we get to the the discussion. So I'm the 47th president of the college. We've been around for 181 years. It's a 3-year term. I'm still a practicing forensic psychiatrist, and I do my clinical work, generally speaking, on a Monday and a Tuesday, when I cycle into work across the Devon Hills, which is fantastic. And then I pick up my Brompton and get on the train and come up to London. Next slide, please. So in terms of my priorities, they are parity between mental and physical health, championing equality, diversity and inclusion, workforce well-being, and putting sustainability at the heart of all we do. But sustainability runs through all the other issues. And generally speaking, in terms of my priorities, I've had fantastic backing from all our members. I've been really heartened by that, and they really seem to be really very much behind it. But sometimes you still get people. I had a letter the other day saying, you've really lost your way, you know, talking about equality and diversity and sustainability. What about patients? What about patient care? And people say, well, so people unfortunately don't get that this is core to patient care. This is both now and in the future, and unless we get to grips with this, then our patients will suffer. So this is all about patients. It's not about some weird or wonderful thing that's on the side of all of this. And so we undoubtedly have to do more to make sure that people really do get it. But I think more people do. I've been really heartened by the way people have actually bought into this. Next slide. So in terms of our journey on sustainability, next slide. So we have two associate registrars for sustainability, Lisa Page and Jacob Kranowski. And we had an associate registrar beforehand, Daniel Morn, who may be known to some of you. And he was our first associate registrar. I appointed him when I became registrar. You can have 5 associate registrars. I thought it was really important to have somebody who led on this, who knew a lot about it. Daniel had already had a 2-year secondment, a full-time secondment, to look at sustainability and mental health, and came up with a number of publications and built a real network in relation to climate change. So I think you do have to have some leadership. That's showing people how important it is, but it's actually creating a real focus. So we've got a RC Site Planetary Health and Sustainability Committee. They take a very sort of broad view on what sustainability means. It's not just carbon counting, it's and environmental issues, but all issues to do with social justice, and seeing this as a human rights issue. We have sustainability scholars. So we have advanced trainees who use their special interest day to work for a whole day each week in sustainability. They sometimes do projects with the college. They sometimes do projects with their local employer, or with voluntary community groups where they work. So that's a huge sort of source of both developing expertise, looking to the future, and growing people's interest. Next slide. So in terms of the core principles of practicing sustainable psychiatry, prioritizing prevention, I do remember, unfortunately, going to meetings at the college, quite high level meetings, when we were talking about prevention. Prevention was never one of our high level strategic objectives. We say, well, we've got to talk about prevention. People say, well, we haven't got time to talk about prevention. It's we're doing the day job, people would say. And it was quite a struggle, I have to say, to get prevention to be being seen as a core issue for all psychiatrists, everybody working in mental health. And that must be our first obligation to our patients. And we know that all our services are under huge strain. There's no service on the planet that has been able to provide the service that they would like to. So prevention has got to be at the core of all of this. And the evidence base around prevention in mental health is actually pretty good. It's just that we don't follow through on it. So empowering patients, communities and staff, again, we know that is more sustainable if patients are empowered in relation to shared decision making. They're more likely to work with teams to actually follow their care if it's seen as a shared thing. We know, for example, in terms of medication, that huge numbers of people don't take their medication across the whole of medicine. that's just the reality. And we know that the more buy-in there is, the more likely people are to take their medication and not waste medication. And we know in terms of the carbon footprint that procurement of drugs is the biggest element of all of that. So this is not a minor issue. So empowerment of patients is really important, to give them the best possible care, but also to cut down waste. A high value care, looking at really what you put in and what you get out, to make sure that the equation is appropriately set, and to consider carbon in all that we do. Next slide. So again, it's a presidential priority. I think that's really important, to have your most senior leadership, that as to them actually putting their, putting it very clearly out there that they think this is a priority, and people getting a chance to vote on it. Just in the building today, we've got the beginnings of our presidential election, my replacement, and all my replacements have been doing their videos today. I'd be curious to see what they say about sustainability. I very much hope I've spoken to all of them. Of course, it's up to them to set their priorities, but to say, well, you can't, this is not just a 3-year program, as RCPCH have already said. It's here, I'm afraid, forever. And so I would want to see them continuing to take that forward as a priority. Next slide. And it's what our members want as well. So key pieces of work. Next slide. So in terms of eco distress, we did a survey, and 57% of child and adolescent psychiatrists seeing children and young people who are distressed about climate crisis and the state of the environment. Quite sort of staggering. So again, a core part of their work. Global warming events like floods, fires, droughts, harm to animals as a result of corruption are affecting the mental health of the younger generation. We try not to talk about climate anxiety. Much of this is an understandable reaction to something, and what you do about it is actually treat the root cause, the climate crisis, not focus on the distress, or it's a part of prevention, actually getting to the core of the issue. And we had a campaign in November 2020 to raise awareness about this. Got a lot of publicity around it, because it's something that people are seeing in their families, in their classrooms. Next slide. So we have a number of resources on eco distress and other matters for patients, for psychiatrists, for people working with people with mental illness, and working with young people. Next slide. So we published our Planet's Climate and Ecological Emergency, our position statement, in May 2021. We declared a climate and ecological emergency, and this is what we have. This is an emergency. It requires urgent action, and it's a core mental health issue. The link between climate change and mental illness is strong. The evidence we do need more evidence, but there is absolutely undisputed evidence in terms of the links, not only forced migration, which is a terrible cause of mental illness, but for instance, particulate emissions and depression and dementia. The link is getting very much stronger indeed. So this is a core issue in relation to mental health. Next slide. So we've made pledges as a college for medical education organisations, for research organisations, and for the UK government. We pledged by 2040 to achieve net zero carbon level emissions for emissions that we directly control. And I know, Richard, you've made that point about suppliers, and I think that is something we do need to look at. I wanted to go further, faster. I was persuaded not to. I would hope that we will beat 2040, but we'll see. And I guess in relation to the very important point about measurement and openness, I think, like a lot of organisations, we slightly lost our way during the pandemic, and it all became very different, didn't it, in terms of the doing something meaningful. And so we've now contracted an environmental consultant agency called Green Element, who are doing a very robust assessment of all elements of our sustainability and our carbon footprint. They're going to do a report every year with an introduction to carbon footprinting, the scope and boundaries of the footprint, summary by scope and activity, breakdown of results by activity, emission hotspots, target setting, making recommendations. It's going to be tabled every year. We will make it openly available so people can see what we're doing. I think that's absolutely, I've always thought that open data was absolutely vital. You need to expose what you're doing, even if you look at it and think, I feel a bit uncomfortable with that. In fact, all the more reason to do it. You're more likely to get something done as a result of that. So we are taking that seriously, and we've got the external element to that. We're promoting prevention. We've just developed, we paid for as a college, a public mental health implementation centre. Pretty well all of that really has a very strong sustainability element to it, and we're working very closely with OHID, and we've taken over half of Public Health England, and again prevention is key to that. And we've been working with Chris Whitty and Janelle de Gruchy looking at 3 core projects that we can really show how prevention works. So I think that's going to be really important, and we're creating an alliance working with others across mental health organisations, both in the UK but globally, and we had a lot of contacts again through COP26. Next slide. So what about for all NHS organisations? I feel that every NHS health organisation, commissioner and provider should produce a green plan by the end of 2021. That was what we had said. I think there are plans really to do that mental health provider organisations should develop and implement a biodiversity action plan. So in terms of things like, greening of estates, this is really important to our patients and to their recovery. And I think you have to triangulate how you do things. I've earlier on this morning just been meeting with the CQC, and one of the things I've been arguing in relation to their inspections is how you can actually get sustainability within every aspect of their inspections, and make sure that there is a line in the sand that if you're not doing certain things, for example, if patients don't have access to nice green spaces, then care cannot be considered to be adequate. And we have our College Centre for Quality Improvement. We have 1,500 teams that are part of our quality improvement networks across all sorts of different branches of psychiatry, and now all the standards within the standard setting, and we have peer review, that we've got sustainability built into all those standards, so they're an intrinsic part of it. So we also want to establish a natural services network to map all sites in the local area that provide opportunities for sustainable interaction with nature or activities, so that we create a learning environment. Next slide. I don't think I've got too many more. We want to incorporate the goals of choosing wisely into daily practice. So this was I think it came from Canada and New Zealand, didn't it, in saying, look, we've got to cut down on waste, and unnecessary investigations, unnecessary treatments, and particularly treatments where they're proven to be harmful. And unfortunately, again, this still happens. We want to make sure that the integrated care systems, integrated boards, that they incorporate sustainability. We've got a very good network in relation to the ICBs and their mental health element. But this is the ultimate issue, isn't it, across the whole of medicine, and we've got to make sure that we get in there. And we want commissioners to embed social prescribing into community and inpatient mental health care. And again, the evidence base around social prescribing is growing all the time. Next slide. So we want to expand the NHS Sustainability Awards, make sure that there's a full mental health element within all of that. We are calling on NHS organisations to jointly develop minimum standards for providers in developing sustainable services. and commissioners to include these minimum standards in their contracts. If the commissioners say you've got to do it, well, you pretty well got to do it. So again, it's the triangulation and getting the CQC in there as well. Next slide. Just finally, sometimes say, well, look, I want to do something, I'm not sure what to do, what can I do tomorrow in my practice? And one of the early things we developed, this is about 5 years ago, was top 10 tips for practicing psychiatry sustainably. So next slide. So just briefly what they are. So to see your work as a psychiatrist is primarily aimed at secondary and tertiary prevention, getting prevention in there straight away, making sure that you have an endless look for, if you're prescribing, you have the lowest effective dose. We all need a reminder about that in our practice. It's too easy just to carry on prescribing the same medication. You really need to look at this from a sustainability perspective, as well as, obviously, most importantly, what is the best for patients. And of course, the two, they are one and the same, really. What is sustainable is best for patients too. Encourage social prescribing and green care programs in the local area. Next slide. So encourage the use of recovery model, using coaching, peer support and carer advocacy, for clinicians to be mindful of the impact on ourselves, looking after ourselves, and see self-care as a priority. We know that in the pandemic that the workforce well-being became a very big issue. It still is a very big issue. There are people who are exhausted out there, and the NHS is under huge strain, and we must make sure we look after ourselves so that our careers are sustainable, as well as the planet. Consider walking, cycling, public transport or lift sharing. We have a don't take a plane approach to our work. I'm off to Edinburgh later on tonight. I'm on the overnight sleeper. I've not used it before. I've done it during the day. It's a very long journey, so I'll report back on that. I don't know if you actually get any sleep on that, but it all looks very nice. So take the train if you can, and always take your bike with you as well. But look at public transport and lift sharing. And you have to make this all, easily done and pleasurable to do it. Not something that people want to say, oh, well, I'll do it if I have to. I think there's a really important message around this. Is a really positive thing. This is not about taking a whole load of negative stuff away and making your life more painful. Actually, you have to vision how this actually is a better world for us, for future generations, for our patients. It's not about it being worse. The whole thing is much better. Next slide. So, where possible and appropriate, consider reviewing patients' carers by telephone and video link. This was before the pandemic, this came out, so that's become sort of custom and practice. We've got to make sure that to where that's appropriate, where it's possible, that we continue with that. We need to make sure that we work with patients to empower them, and so they become experts in their own care, and also the carers around them. Ensure that the services usually on a depot, that you have the minimum dose possible, and work collaboratively with colleagues for that interplay between mental and physical health. So I think that's really all I wanted to say. But we've been on sort of quite a journey. I think it was a bit interrupted by COVID. It obviously had a positive effect, not as positive as people actually thought. Actually, when you looked at what actually happened to carbon footprint over COVID, you would have thought there would have been a much greater fall. But so there is a lot of work to be done, but we're very much up for it. Thank you.
Thank you. Thanks so much, Adrian. And it is incredible what you've achieved at the Royal College of Psychiatry. I was particularly interested myself in the top tips, which will be transferable across many other areas of healthcare. And at the UK Health Alliance and Climate Change, we're doing some work at the moment with our members to develop a list of what members can do in their organisations. And I hope a lot of what people have heard today they'll be able to take forward. But we're hoping to condense that down to the top 10 things, the practically tangible, achievable things that organisations can realistically do. And we're hoping to do some work on that at our council meeting at the end of September. So I'm going to open up to any questions. I think there may be a couple in the chat, but if anyone wants to put their hand up as well to ask questions, we've got about 15 minutes left. So please put your hand up if you'd like to ask questions, and I'll have a look in the chat as well. And don't be shy. There is a question in the chat from Becky Rhodes. So the question is around, it was during Alison and Liz's talk. How do we take this to our governance leads, i.e. the trusts, ICSs we work for? How do we get the senior leaders locally to buy in, whether pediatricians or whatever profession, but how do we get senior leaders buy-in? So if anyone's got experience of how they managed to get that buy-in from their organizations. Liz, do you want to?
Well, I mean, I don't have any easy answers. I'll speak to Becky at length about it because I think she's just seeing a patient for me actually in the next room. You know, it's tricky, isn't it? I mean, the healthcare system I work in, which Becky does know, you know, I think we've been fairly successful at getting into the ICS due to the passion of one particular individual clinician, Dr. Clements, who's also one of our working group chairs. So we have, you know, every ICS has a green plan, but we also have an active clinical reference group about it. Within our own trust, I would say, again, we do have a green plan, but there does seem to be something of a mismatch between the management buying it, the estates owning the plan, which the estates own the plan, and talking to the people, the clinical teams, about how it impacts them. And I think it's just individuals going there and going, you know, bending people's ears again and again and again. I think getting buy-in from somebody senior on the trust board is what we need to do, and I'm working on that, Becky. We've got a new chief executive who starts next week, so I was just thinking of perhaps trying to book an appointment with him. I think it's lobbying, but I think what we can all do is give each other the tools and the support to do that lobbying. And that's why I think organisations like UK Hack are so useful.
Thank you. Thanks, Liz. Richard or Adrian, did you want to come in?
I mean, I think
I'll say something.
David, yeah, sorry, Richard.
After you, Adrian.
I mean, David made a good point. You know, it's not you know, what do you know, what are you going to do anything? It's, you know, how you're going to do what you must do. I think it has to be the approach, and I think we do have a golden opportunity with the ICSs and ICBs that you know, this is one issue that they're ideally set up to deal with. So I don't know. I mean, I've met with all the chairs of the ICSs and about mental health, and as part of that, as I always do, mention sustainability and how important it is. They and also to frame it in how can we help you to achieve what you must do is, I think, is really important. But that leadership does change and organisational structures change, so you have to keep anticipating what's going to happen. But you know, I wondered, Richard, whether we should separately actually ask to meet with the chairs of the ICSs, ICBs, and raise it with them. But again, in a sort of helpful, how can we help you to achieve your target, what you need to do? Because I'm conflict of interest. I'm married to a ICB chair, so that always helps actually. Marry your senior leaders locally, but it's a bit of an extreme approach to take, but it's worked for me.
I just add a few points. I mean, all the ICSs are required now to produce a plan. It's now written into the Health and Social Care Act that this has got to happen. In England, the chief executive of NHS England has made it one of her 4 priorities. So I think there's now a lot of pressure on ICSs and trusts to do something. They've got to have a plan, and they're all being scrutinised. And of course, as you'd expect, there's going to be big variability. Some of the plans will be a lot better than others. And probably the best technique, again, going back to David, is to support people to do as well as the best. But we must mention the other 3 NHSs. Scotland is in the process. We're expecting its plan to come out towards the end of August, so it should be published any time. It existed, I understand it, before COVID came along, but it was put on one side during the pandemic. Wales has a plan, but how much it has the resources and the staff and the funding, I mean, you need investment to be able to do things differently. You certainly need staff. And as I said in my presentation, a plan without staff and without funding is really an empty plan. And as far as we know, Northern Ireland has got a commitment, but I don't think there's really anything happening in the NHS there. So I think we are the UK Health Alliance. We have to think about all of the NHSs. And I mean, and really, in many ways, a tribute to David, NHS England is just way ahead of anybody else anywhere in the world when it comes to a whole health system, which is because there has been somebody thinking about it for a dozen years. It hasn't just popped up. I mean, it was a tough gig for many years, as David will tell you, but now people are almost competing with each other to do better than the others.
Thanks, Richard. I've just put in the chat, Scotland published their strategy just the other day, actually. It's just been published. Liz, see you've got your hand up. Over to you. And then there's been another couple of questions around resource. So we'll come back to that.
I was just going to say something else that we've done. So I'm on our our regional clinical Senate council, and I don't know if anybody knows what the clinical Senate councils are, but they are bodies of clinicians from all disciplines which are set up for each region. And one of the concepts is that they should be critical friends to NHS organisations who are planning change. So they have a role in reviewing plans and advising. There is no statutory role to do this, but it's just that NHS England will ask organisations when they've had peer review. So we did a presentation this week, which went down really well within our local one. And one of the things I'd like to see is that we almost have, Richard, you talked about having a governance framework like an accounting standard, that whenever we do a system review or a hospital review or a change review, that we actually have a toolkit of questions we ask them. And I think if we could produce something like that and we build it into our practice as normal, we always want equality impact assessment and things like that, whether we also have a sustainability impact assessment added to every review we do. I think that would be huge.
Thank you. Thanks, Liz. And there's a couple of questions around resource, which I think is quite interesting because it has come through quite clearly in all of the presentations about the need to properly resource and have dedicated people working on this and not have it as an add-on. So there's one from Eleanor Dam. How do you secure funding for the scholars and full-time fellows for sustainability, specifically addressed to RC Psych? And also we have one from Terry Kemple. Do the colleges, so the 2 colleges, have any idea how much the extra activity and sustainability has cost the colleges? And what is your advice for selling this extra activity to other colleges? So Adrian, I'll go to you first.
Great. The sustainability scholars, the first 2 tranches, we got external charitable funding, and then we lost that. And the pandemic obviously didn't help, so we funded it ourselves through our own resources. But we have now a new director of fundraising, and it's one of the things that we're optimistic that we will always be able to get some funding. It's relatively small amounts. Clearly the actual time that people are putting into it comes from that time that would be allocated to their special interest group, and so it's I think one of the positive things about it, it's the trusts have to sign up to it and see this as being a good thing to do. So you get more of a buy-in, and people have to own it as being an important issue that they would be wanting their trainees to be gaining expertise in. And of course, if they can help them with a local project, that's a win-win. So some external funding, sometimes if it's important enough to you, you sometimes have to put your hand in your own pocket, and that's what we've done. I guess in terms of what it's cost overall, I'm afraid I couldn't give an answer to that. I just think, how do you sell it? We have to do this. I don't think there's not a choice here. We have to do it. You have to argue it on the basis of it's about patient care. That's our aim as a college is to improve outcomes, experience of our patients, and this is an important way of doing it. It's a growing way of growing importance. And in terms of issues around prevention, we have to maximize everything, every possible thing we can do around prevention, because we cannot go on meeting the need, and everybody knows that. So if you want to actually do something about the huge increasing demand for mental health services, you have to look at prevention. So there's something in this for everybody, we have to do it. And actually, the outcome is a better one. That's what I always sort of say to people. It's actually, if you look at people's lives, you look at their environment, everything is actually better about this. It's not like taking people down a terrible tunnel of, it's a positive thing. So why wouldn't we want to go there?
Thanks. Liz, do you want to talk about how you've resourced and the costs?
I mean, I should know, I'm the treasurer of the college, so I should be able to answer that. I mean, I think the answer is that it's not as expensive as you might think, because apart from Alison, which is obviously a salary, the rest of the work is largely done by volunteers. But I don't know whether Alison can answer about where we're looking to for funding for the sustainability fellows.
Yeah, so just similar approach to Adrian. It sounds like we are looking externally to start funding a clinical fellow program initially, with potentially putting in some money from the college core funds as well. But we are looking to get funding for more dedicated posts. But as Liz has said, the cost at the moment is relatively very small in the scale of the college itself, because we've got around 80 members who lead a lot of the work on a voluntary basis across our working groups. So we're very, very grateful that they give that time, which means that we can do so much.
Incredible. Richard. You're muted, Richard.
I think this is now core business for colleges, as it is for the NHS generally, not just because, as Adrian says, we have to do it. But now that the NHS is committed to getting to net zero, what does that mean? What does mental health net zero look like? Well, the obvious people to work that out are the mental health professionals together with their patients. What does pediatric net zero look like? And as colleges, it seems to me the core functions are standards. How do we have the best possible practice? Well, that's relevant here. And you're about education, as Alison said, and there's a huge education job to be done here. So my argument to colleges would be, this is, whereas it might have been 10 years ago, you thought, it's a pity it wasn't core business then, we'd be in a much better position, but it wasn't. Whereas now I think it's core business and needs to be considered at every board meeting and every level.
Thank you. I'm going to squeeze one more question in, and I'm going to direct it at you, Richard. So it's from Angelique Mavrodaris. I apologize for my pronunciation if it's incorrect. And praising the alignment with across colleagues and organizations and across sectors. But have we, and is there value in us coming together strategically to ensure we're working most effectively and collaboratively as a health force, plus social care?
Yes, I suppose that's what we're trying to do with the Alliance. And one thing that I regret is we're certainly not doing much around social care. And I certainly believe that healthcare and social care are really one thing. So that's a place where we might make progress. And clearly, when it comes to advocacy, which is a lot of what the Alliance is about, the more members we have, the more we can say, because at the moment we have about our members have 960,000 members. There's some double counting there, but but that's a large proportion of the NHS workforce. So we can speak with a loud voice, but it has to be said that I think it's generally accepted that health professionals have not really been as prominent as we should be in this debate. I mean, as Adrian says, we potentially have a very strong message. This is the most important thing affecting health. We have no choice but to start doing things. And actually, there are probably substantial benefits from the things we're advocating. So we're doing sort of okay, but I think there's no doubt that we've got to do better. And probably we need to work more closely with environmental groups and other groups. But the more we come together, the more impact we can have. And that's why it's so exciting to hear how well these two colleges are doing. Other colleges are doing equally well, but some colleges still have got a long way to go. It's not quite the priority that it is with the psychiatrists and the pediatricians, and I hope soon it will be.
Thank you. That's us at 1:29. So we'll close the session there. Thank you so much to everyone who's joined us today, and thank you to our speakers. It's been the most fascinating talk on governance. So thank you all so much. It's incredible to see all of the work being done, and I do hope it will be an inspiration to others. Thank you, everybody. And we will share the slides afterwards, and the recording of the presentation. We'll make that available for those who've asked. Thank you. Thanks.